Welcome everyone to Make It Make Sense. I'm your host, Monique Pressley. Thank you so much for joining today. I'm happy to have you with us. As promised, we try to do exactly what our show title says, make it make sense. We take complicated topics, things that are important to our community, to our culture, to humanity, and we dial down the noise and the rhetoric, the bickering, the back and forth that's just become a part of what we're calling news these days, and we're giving you the who, the what, the where, the when, the why, all the things that you need to know so that you can live an informed life and make informed decisions for your present and for your future. Today is no different than any other day we try to do that. We have information that we need because whether you guys know it or not, COVID is still out there. Did you guys know that? Did you guys know that there's still COVID? That there's still a pandemic? That COVID-19 is still a thing? That there are new variants? That there are all kinds of people, everyday people on the street to the highest echelons of our government who are still testing positive for COVID? And so we want to make sure that you get the best information possible and that you are doing everything necessary to keep yourself and your family safe. I have a guest who is going to talk to us about those things. But before I bring him on, I just want to flag the fact that yesterday there was a White House briefing with White House Press Secretary Jen Psaki and with the new person who is in charge of COVID response, the COVID response coordinator, and that's Dr. Ashish Jha. I believe I'm pronouncing the name correctly. I just wanted to share a few slides. As I said to you all previously any number of times, you can go to whitehouse.gov and go to the link for the briefing room and figure out what's happening on any given day in the White House, what's happening in the briefing room. You can get a readout for that information that they are sharing. You can get that information. All of the press briefings are public. You can find the information for the briefings. You can watch the briefing on whitehouse.gov. You can see the information on C-SPAN as well often, and you can find the rebroadcast of it on whitehouse.gov, or you can watch it at the links on C-SPAN. And I'm seeing some people saying that they have tested positive for COVID in our comments. We're praying for you all, and please pay attention to the information that we're about to share. Let me just share a couple of slides very quickly. So this, if you go to whitehouse.gov, you'll be able to see this readout. This is from Jen Psaki yesterday and from Dr. Ashish Jha, who is the new White House COVID response coordinator. This is from just yesterday. So if you look in the briefing room link, whitehouse.gov, it'll be close to the top because it's from April 26th. And so as you can see, he's just saying that he's thankful to be there and that he believes we're at an inflection point. I'm looking right here, like a third way down. We know that the BA2 subvariant of Omicron has become dominant. Cases are rising in the country, but hospitalizations are at the lowest level of the pandemic. 100 deaths a day, though, so that's too high. And there have been more than 200 million Americans who have been vaccinated, and more than 100 million Americans have been boosted. That's good news, but the virus is tricky. Let me just give a little bit more of what he shared. The things that they're aiming to do, one is to push these over-the-counter antivirals like Paxlovid. And the second is the president has announced 2,200 test to treat sites across the country. So that's the information, the hot off the press information. Let's see if I can do one more slide. This is a slide that he shared of the actions that they were taking yesterday to nearly double the number of places oral antivirals like Paxlovid are available in the coming weeks. They are launching new efforts to stand up federally supported test to treat sites. They're supporting medical providers with more guidance and tools to understand and prescribe treatments. And they're communicating to the American people that safe, effective treatments are widely available, because there are these rumors out there. I'll talk to our guest about that, about who can and cannot get certain things. Finally, as you know, we were on with our guest yesterday, Lauren Victoria Burke. She's a political reporter. And while we were on, we got the breaking news that our Madam Vice President, Kamala Harris, tested positive for COVID-19 yesterday. She is asymptomatic. She has no symptoms. She was tested as part of the White House testing protocols. And we then learned later from a release from her press secretary that after the advice of her doctor, she has taken the oral antiviral Paxlovid, which is available in order to help people from getting really, really sick when they are diagnosed positive with COVID. And she is vaxxed and boosted. She has had the vaccine, both rounds of the vaccine, and she has been twice boosted because she is over 50 and the recommendation is for boosting. Now, that's all my regular news. Let's bring in an expert. It is my pleasure, my honor, and my privilege to have as our guest today Dr. CoreyHebert. He is the CEO of College Health TV. He was the Chief Medical Officer for Black News Channel. He is the Chief Medical Officer for Ilera Holistic Healthcare Incorporated, an assistant professor at LSU, Louisiana State University in Baton Rouge, Louisiana, and an assistant professor at Tulane University, Chief Medical Officer for Dillard University. He's an expert, y'all, and we have him with us today. And that's from both my mom and my dad's home state of Louisiana. So I am proud to bring in a native. Hi there.
Hi, how are you? Good to be here.
Thanks so much for being with us, and thanks for being patient with me while I at least got everybody up to speed on yesterday's and this morning's news so we can all start from the same place. But it is just an honor to have you. Welcome to Make It Make Sense. And I understand that you were traveling and still were able to come on with us today, so we really appreciate it.
Correct. Yeah, I'm actually in the airport now, but I had to make sure that people get this information because it's very, very vital to our as African Americans, our longevity in this situation that's brewing here, and it's a very ominous situation right now.
Okay, and let's start there then, Dr. Hebert, because the question, I put a title on today's show and I said, COVID update, where are we? Because frankly, I believe people are confused. There are still those who are kind of deniers and maybe don't want to be vaxxed and all of that. But more than that, we've got people like me who is vaccinated and boosted and don't have a clue when I'm supposed to be wearing my mask, when I'm not seeing sure guidance or updated guidance from CDC. And then we've got federal judges coming in and telling us what they think the law says we should and should not do, and what the government can and cannot tell us. And it all just sounds like a bit of a mess. So where is this virus and where are we?
Okay, so a couple of things. What we have decided in this country, much to my dismay, is that we have collateral damage. And the collateral damage that is going to be accepted are the people that look like you and me, so brown people, people that have pre-existing illnesses, people that have immune systems that are compromised, people that are poor, people that are disenfranchised. Those are the people now that are the collateral damage because the country, quote unquote, basically had to move on. And we have done this with other viruses, other illnesses. I mean, you know, we had Ebola, and then where did it go, right? We had Zika, where did it go? We had the flu epidemic in the early 1900s. You know, things must move on, and then you have to accept the collateral damage, meaning that right now in America, still 30,000, 40,000 people die every year from the flu. Okay, so the point is, though, I was in in Europe and in Africa, you know, doing this surveillance and having these meetings, and basically the Omicron BA2 variant is the variant that's most prevalent in the United States right now. The issue, though, is that, you know, we have lifted the mask mandates, and that's a real problem right now. There are people on airplanes that know that they have COVID-19 that are traveling. We know that. I have multiple friends, doctors, multiple that are positive for COVID-19. Some of them have no symptoms. Let's say our vice president, she didn't have any symptoms. But I have several friends that are very ill, and they've been vaccinated and boosted. Now, the issue is that I have to make sure that people really understand this, okay? The issue is that vaccines are not meant as a panacea. And that's what people don't understand. Vaccines are like safety belts in the car, right? As a doctor, I have unbuckled dead people from an accident. I've unbuckled their seatbelt. So they did all that they could to mitigate if they would happen to get into an accident from dying. And then they still, rarely, it happens, and they died in the seatbelt. That is what a vaccine is. It is a process and a medicine, a medical modality to decrease your risk of dying from this disease. Now, where we are right now is that over 1 million people have died. Okay, that's just point blank the reality. Okay, in the United States, there are billions of people that have gotten this disease, and right now, the mask mandates have been lifted. So we know that Omicron was a very, very contagious virus. We know that. A subclass. The BA2 was very, very contagious, but not as virulent, meaning didn't kill as many people. But we don't know if that's because so many people and we were close to herd immunity or closer to herd immunity, or if so many people had gotten vaccinated. But the issue is it's not going to go away because the world is not vaccinated, meaning the virus only can mutate when it's infecting people. So the higher your vaccination rate, the lower the mutation rate. So only 20% of the world is vaccinated, which means the variants will come from other places and they will come here. And you won't hear about it much in the news because, as I circle back to my original point, and we can take a pause, is because the people that are going to be dying are disenfranchised people. So you're not really going to hear, oh, there's a big outbreak, oh, there's a bunch of people dying, because it's not going to make the news because the people that are dying don't matter in America, quote unquote, and that's the issue.
Right. But okay. And I want you to keep going. I need clarity, because I followed you saying that because other people elsewhere, the world is not vaccinated, the virus isn't going to die. Maybe I don't have a good understanding, because we have people who are vaccinated, who are twice boosted, like our vice president, and that didn't keep her from getting it. It's going to, praise God, likely keep her from being very sick. And we'll talk about antivirals, but what is the stop for the virus if even when vaccinated, you get it?
Well, this is the issue. There will never be a stop to this virus, just like there was never a stop to influenza. There's never a stop to rhinoviruses. There's never been a stop to coronaviruses, because coronaviruses have been around. Just look at the back of your Lysol can from 5 years ago, and it's going to say kills coronavirus. It's never going to go. Bless you, bless you.
Thank you.
It's never going to go away. The only disease that's ever really been eradicated that's a viral disease really is smallpox. That's the only one. So we're never going to get rid of it 100%. It's just that how do we deal with it, right? So we have 5 stages of a pandemic. The first one is the actual pandemic. The second stage is deceleration and going to be endemic, okay, which means that you'll have pockets around the world where people will be sick, and then those pockets will maintain it, quarantine it, and deal with it in that way. And that's what this is going to be very soon, if not exactly right now. So what we have to do is know that just like people get the flu shot every year, right? I mean, millions of people died from the flu in the early 1900s from that epidemic, from that pandemic. And so now that number's down to 30,000 a year, sometimes 40, sometimes 60, sometimes 20. Okay, so that is where we are. 1 million people died from this. But what I will say is that in a couple of years, there won't be many people dying like the flu, because the coronavirus is a very, very, it's a very weak virus. It's just that, and I'm going to give you a real point of that where people can really understand. Okay, so viruses, their job is to kill you. Okay, whenever you get a viral infection, I don't care what it is, if it's herpes, hepatitis, coronavirus, whatever it is, its job is to kill you. And we don't have medicines that kill viruses basically in the blood, right? Like bacteria, we have antibiotics. We don't have that, right? So basically what happens is that your immune system must beat the virus for you to live. If the virus beats your immune system, you die. If your immune system beats the virus, you live. Okay, and that happens all the time in our bodies, 24 hours a day, 7 days a week, as soon as you live, as soon as you get born, right? So let me explain to you, and this makes perfect sense to people. Why did old people die and young people didn't die? Well, at the beginning, remember, it was all just elderly. Okay.
Yeah.
When we have our
Strength of the
immune
immune
system,
system.
okay,
Yeah.
our immune system, when you're a kid, is very strong. Okay, it's just never been exposed to anything, which means it can get exposed to something, make antibodies very quickly, and then be absolutely fine. That's why children get colds all the time. They get colds, and they make their antibodies and they're done. Right? Those antibodies that they make leave what's called memory cells and T cells in the body. Older people, very old people, they don't have a very good immune system. Older people don't have good immune systems, okay? But what they rely on is the exposure that they've had for their entire lives to have these cells in their body, so that when they get exposed to this again, that's how they make the antibodies, because they've been exposed, okay? So older people got exposed, didn't have the antibodies to coronavirus SARS-CoV-2 because nobody did, and they couldn't make antibodies because their immune systems were bad. So that's why old people died, young people didn't, and somewhere in the middle, you have everybody else, okay? Pre-existing illness folks, they're going to have issue. People that have immune compromised states, they're going to have an issue. People that are very stressed out, people that are overweight, people, all these things have issues. Everybody else, usually you're pretty good. And right now where we are is, and I'm going to say this, especially because this is the reality. I said this before coronavirus really popped up. We have to do better as Black folks. We have to get healthy. I tell people out there, go get your high school picture, put it on your mirror, and get high school fine. Because right now it ain't going nowhere. And right now we have to do this as a group. We have to. And now if you're still alive after coronavirus, do like this. Whew, you made it out, right? Don't wait again. Don't wait again, because the next thing is coming, and we don't know when it's coming, but you need to get healthy and quit doing the things that cause the problem.
Since last fall.
I'm
serious about it.
There you go.
I'm serious about it.
Absolutely,
and I want everybody to be serious about it. We're about to start a weekly physical health challenge on here so that people can get that understanding. But if we're on an airplane, tell me this, because I'm not listening to that federal judge, and I'm waiting on the CDC, and they're not talking loud. And as you say, there's obviously been a decision. When I'm on an airplane, I'm wearing an N95. Is that what you just put up?
Correct. That's what you need to do, and use my mantra: wash up, mask up, separate, and vaccinate. Now, when you are in somebody's face very closely, you need to wear a mask.
Say that again, Dr. Hebert. Say that again.
Wash up, mask up, separate, and vaccinate. That is what I've been saying from the beginning. And I hate to be this way, but until I tell you that you shouldn't wear a mask, you need to still wear one, because people are still getting this disease.
So we've got the wash up, we've got the mask up. I'm just dealing with, because you're right there in that airplane, and this is what people are wondering about. Mask requirement. Everybody can't be first class where they're going to sit a little distance away. I've got somebody right next to me. They're not wearing a mask. Let's say they have COVID. Is my N95 the protection that I need, or is it more I'm protecting somebody else and I'm a sitting duck in that seat?
You are, the best that you can do is to wear eye protection, meaning glasses, so things won't fly in your eyes. Also wear an N95, a mask, and that's the only thing you can do. The bigger things, though, is you need to make sure that you wash your hands, because we touch our faces 200 times a day. We don't realize that. So if say your hands are out, the person, before you sneezed on that, right? And the COVID-19 is sitting on the bench or on the handle. If you wipe your eye, you're in. If you pick your nose, you're in. You touch your face, you got to keep those hands washed. That's the most important thing of all of this.
But say I'm unvaccinated, I need to not travel. Is that what I need to not do?
If you are unvaccinated and you've never had COVID-19, you really need to wear a mask. I mean, I don't, and people can say all they want about, we don't, masking is stupid, blah, blah, blah. As a doctor, we always wear masks. We have always worn masks. So if masks are not effective, then why do we wear them in surgery then? Why do we wear them when we're doing anything that requires us to not inhale something bad or to spit something bad out, right? And so we know what N95 means. It means that it blocks out 95% of particles that are 3 microns in size or bigger, right? So that is what that is. That's what that's for. Now, if you don't want to do it, hey, you don't have to do anything. But what I will say is, and this is where the rubber hits the road now, and this is where I really want people to understand this, okay? If you get COVID-19, okay, and let's just say you don't really get sick, that doesn't mean that you don't have long COVID. And this is where we have an issue. Right now, what we're looking at as medical doctors, we are going to have an entire discipline, like an entire residency or fellowship, as we move forward to train doctors to be able to take care of long COVID patients as symptoms go in the next 10 to 20 years, because we do not know. So the key to this thing is, maybe you get COVID and maybe you never know. Maybe you get COVID and you don't get very sick. Maybe you get it and you get very sick. The difference between you being sick with a positive test, you being kind of sick with a positive test, or being not sick at all with a positive test has no correlation on whether you're going to get long COVID. And when long COVID happens, that means that your heart rate goes up, your blood pressure goes up, you increase your risk of diabetes, you increase your risk of stroke, you increase your risk of everything. So at this point, you have to choose. And do I want to make this a political statement and say, I'm just tired of it? Or do you want to risk getting long COVID and then having the medical establishment taking this so seriously that we're trying to establish a whole new fellowship and training just to take care of people that have had this, because we don't know what's actually going to happen, okay? So that's where we are.
Okay, so one last question. What's your thought on these oral antivirals?
Oral antivirals are very good. The monoclonal antibodies, I just was published in the New England Journal of Medicine for all my work with the monoclonal antibodies infusion. I mean, we saved so many lives with Regeneron and Eli Lilly monoclonal antibodies. It's untold the amount of lives that we saved. But the reality is that the over-the-counter or the prescription, rather, oral medicines, okay, they're good. Don't get me wrong, they're good, but they are not the panacea as well. Those antivirals don't kill virus. It's not like antibiotics, like people don't understand. Antivirals stop the replication as much as it can, and then it allows your immune system to take over, just like we talked about earlier. So are they good mitigation things? Sure, that's a good thing. But the point is, there is no cure. I mean, there's nothing better than prevention. Prevention is where it's at. That's what you need to do, because even if you get COVID-19 and you take those antivirals, that does not stop the chance of you getting long COVID. And that's what we're working with now, because let me say this, the people, and this is really the important point of this whole thing, the people that made it so that the social determinants of health make it so that Black men don't get treated in the ER appropriately for chest pain, Black women dying on the table for having babies more than in third world countries, Black kids dying in inpatient wards if their doctor isn't Black, 70% risk of dying. All these things that got us to that point, don't think that those things all of a sudden are going to be better after COVID-19 for us. They're not. It's going to be worse. And that's why African Americans died in disproportionate amounts during COVID-19, poor people as well. Not just Black people, poor people, people that did not have access. So now that this is over, we've accepted the collateral damage of COVID-19. So now what's going to happen? What's going to happen is now everybody's going to move forward. We are going to still be getting COVID, but we're not going to be able to get the antivirals. We're not going to be able to get our primary care doctors because we don't have access. We have poor health care. We eat poorly. We live poorly. And then we are going to be having the symptoms of long COVID long after everybody else has moved on, just like every other time. Don't think that the people that didn't take care of you with your health and disenfranchised you from the beginning are going to all of a sudden step up after COVID and take care of you then. So we have to take care of ourselves. So that's what I tell you. Until you see me on Facebook and Instagram saying, put down this mask, that's when you do it. Until then, there's nobody else looking out for you as an African-American person. Granted, we have a lot of doctors. I'm not saying me personally. I'm saying our group of doctors, our people that look like us, we are out there looking out for you. And that's what we're about.
Ooh, well, you got us together today, Dr. Hebert. I know it's making more sense for me than it was at the beginning of this conversation, and I am so grateful to you. Listen, we want you to stick with us, know you personally. We know we have a group of doctors. I'm thankful that Dr. Rachel Villanueva was with us, who's president of National Medical Association, and we talked about Black maternal health. She said some of the same things. The statistics are hideous. We had Dr. Sharon Malone, who talked to us about gynecological issues for Black women, post-menopausal issues for Black women. And we're seeing all of these things, and I intend to do what I can about it. And I'm thankful for experts like you who are just giving it to us straight, for real, no chaser. And we appreciate that. So
Ms.
to us
Pressley,
again, yes, whatever you want to share.
Really have something. Yes, okay, this is really important. Right now, there are 4 million people in America that have sickle cell trait that could drop dead at any moment, okay? I wrote a book about this. It's called Sickle. I want you to go on Amazon and get it. It's really important, okay? Because right now, one of the number 1 causes of death in new Black military recruits in America is sickle cell trait, not disease. There's 4 million people. One of the 16 young Black men have dropped dead on football fields and NCAA sports from sickle cell trait, not disease. People don't understand that sickle cell disease is a bad disease. We know that, okay? 100,000 people have that. But we as African Americans, everybody in America has been tested for sickle cell trait at birth, not just Black people, every person. But right now, we get those results when we're 3 months old. And our parents didn't understand that sickle cell trait is also now, we realize, a disease, okay? So if you are right now sitting where you are and you have no idea if you have sickle cell trait, you could actually go in an unpressurized airplane at high altitude and have a sickle cell crisis and die. You could actually be working out and not understanding why your muscles are hurting more because you have sickle cell trait and you could drop dead. You could actually be hiking or going skiing somewhere at high altitude for a long period of time and not realize you can't breathe, have sickle cell trait and die. The criminality of this, and I'm putting this on my back, and I'll come back and talk about this. I'm putting this on my back. And the reason why is because if everybody in America has the ability to get their results that they took when they were a baby, okay? Everybody in America gets this test. It's a federal law. That if we don't know those results, then that's criminal. And the reason why is because we have the results. They're just at the hospital that you were born in or at your state level at the Bureau of Vital Records. You need to find out if you have sickle cell trait because you can die. The second reason, though, is that if you have sickle cell trait and it takes 2 people with sickle cell trait to make a baby with sickle cell disease. 98% of poor Black young women that have the baby with sickle cell disease had no idea that they had trait because nobody told them. Okay, that's criminal that we're still having people that have sickle cell disease that are going to probably die earlier, be in massive pain for their entire lives, have to be taking morphine and taking all these medicines, acute chest syndrome and almost dying from pneumonia and having their spleens taken out, all this kind of stuff from sickle cell disease.
But what are you supposed to do? What are you supposed to do if you have trait? Because I have 3 children. I know GYNs. I know other women who have given birth to children with the trait, and the OB and the pediatrician tell you, oh, your baby has trait, and you get some information from the government, and then nobody says anything about it ever again. What's the treatment? What's the stopgap?
Okay. The stop that is that you have to know to stop you dying from sickle cell trait. And I'm not going to sit here and say that it's something that happens all the time. What I'm saying is that it happens enough to where we need to know about it, because if it happens to you, it's 100%. What do you do about it? You need to know your body. You need to stay hydrated. You need to, if you're going into these high altitude areas, you need to take medicine before you go into these areas so that you can get more oxygen into your blood. These things it's like an emergency. And so the only reason why people don't know is because it's an African American disease, and we have to call it like we see it. Right now, we need to have a registry where anybody that needs to get these results, it needs to be at an HBCU where you can go on to like quote unquote sicklecell.org or sickle cell whatever and get your trait status so you can know. We're out there spending billions of dollars right now with CRISPR technology and DNA technology to treat this disease and to cure it, when all we have to do is know that if you are 16 years old and you're about to start having sex and you have traits, you need to probably be very careful about who you have sex with so that you don't have a baby that has sickle cell disease, which could cause that baby to die and you to have emotional problem because just your baby, a financial problem because it's extremely expensive to have a baby that has sickle cell disease, a social problem because every time a baby gets sick, every time a baby gets one slight fever, you have to go to the hospital and stay there for 3 days. All these things, people have no idea, and your baby's in constant pain.
I know a family that is dealing with that, and the dad died. They live
Absolutely.
Right in our neighborhood. And it's an ongoing tragedy.
Absolutely.
An ongoing tragedy.
And so we have to do something to stop this. So right now I'm working with a lot of folks and a lot of famous folks as well, so that we can put this on our back. Because don't get me wrong, right now, breast cancer is a very bad disease, okay? It's a very bad disease, but it's not close to the thing that's out there killing most black people. Heart disease is number one. But right now we got black men on the football field wearing pink shoes for breast cancer, while black people are dying from sickle cell disease and having horrible lives because of sickle cell disease. We have to make this change, and we're going to do it in the next year or so. We are putting this project together, and we are going to have that registry. Yeah, I saw somebody that actually has somebody here that says, my son has sickle cell and everything he's saying is true. That's Hell's Wells K. I'm telling you, this is real, and we have to do something about it because nobody else is going to do it. And so what we're going to do is get this registry and make this happen. Somebody asked, could you be tested as an adult? Yes, you can be tested as an adult, but the issue is you already got tested as a child. You don't need to get tested again. You see what I'm saying? It's already there. Go to your hospital where you were born and get those results. It's a federal law you have to be tested. And so right now, I spoke about this to some white guys.
You should be able to access it, but legally there are problems as well. For instance, I'm adopted. I was able to access my records and to contact one of my birth parents to be able to find out information before I had children. But sure, millions of people are not that lucky. People who are in foster care lose the chain of custody of their medical records, and lots of times, and that's disproportionately in our community too, and with people in our community who are poor. So sign me up. Whatever it is you need, and I hope you come back and we can devote an entire show to talking about this, because this is all of our families, and it matters. You woke me up today. I'm all the way. I'm with it now.
Well, awesome. So look, let me tell you, you'll be getting a lot of information out there, and you're going to be seeing this because we are one ad campaign away from wiping this disease out. One ad campaign, if we do it just right. Okay. So we're out there spending $500 million on a Milk Does a Body Good campaign, which milk does not do a body good. And then we can't even get, the money from the feds to do a campaign to stop the killing and the death and the horrible life of a young person. I mean, I'm not going to have it. And so we're going to get this done. All right.
Thank you, Dr. Hebert. Please come back. We want to devote a conversation to this, but we just need you in general. You really did what you've done. I know that this message from today is going to be a benefit to the value and to the lifespan of many people just through your willingness to share. So God bless you. I appreciate you. And thank you for stopping the middle of your travel day in order to share with us.
Thank you. And I'll be back soon. Y'all have a great one.
All right. Take care.
All right. Thank
you. Ooh, we bit off a lot today. And I am so thankful and grateful for all of the information that was shared. I hope that you will do your part so that we can share all of it far and wide. You can tell we had someone with us who was not just a preeminent expert, but was able to wrap his arms around the material and share it in a way that we could all understand it. And that is the gift of a teacher, an instructor, a clinician, because many people, as my grandmother say, have book smarts, but don't know their way out the rain and can't help you find an umbrella. He had the smarts. He knew the way, and he could help us find the way. And so we want him back here again and again and again and again. If you're watching, thank you, Jackie. We appreciate you, because my gifted booking producers is the person who brought Dr. Hebert to us today, and I trust her, and now you can see why. But we will get him back again. But this message will be loaded up to my YouTube channel by this evening. If you're not subscribed to my YouTube channel, it's Monique Pressley TV. Share far and wide. Hey there, Too Raw, Too Real. I hope you heard this show today. If you didn't, you need to catch this rebroadcast, bro, because Dr. CoreyHebert came with all of it. We're updated on COVID. We got marching orders on that. We're updated on, who knew, sickle cell trait and why the trait is killing us and people aren't telling us that it's killing us. We're updated on what we need to do to stay involved, to keep ourselves safe. What did he say, guys? Get that picture of you, your teenage years. If those were healthy years for you, get that teen picture and get back to looking like that pronto, because they are not out to save us. We are, what did he say at the very beginning? Black folks are collateral damage in this pandemic. Well, damn it, not on my watch. So let's get busy. Everybody, let's get busy. If you appreciate this information, please support our broadcast. It's free to you. It's not free to us. I'm EP on this. We're working on getting sponsors. I trust God for everything, because this is information that we need. And when you're doing something you're supposed to be doing, God blows on it, which is what's happening. Thankfully, more and more people are hearing about our broadcast and expressing interest in being involved. We need support. Yes, it is going to be up on YouTube this very evening. So go and find it there, but please support us. The Cash App to support us is $ Monique Pressley TV. You can go to my link tree in my bio to figure out how to do PayPal, how to do Patreon. There is no gift too great or too small. We appreciate them. Subscribe to the YouTube channel. That's also Monique Pressley TV. And hey, spread the word. If you can't help with dollars and cents, you can help with what you have, your own platform. Share about this broadcast, that we're here noon daily on IG Live, that the episodes end up on YouTube. Use your little share symbol when I post the promos. Share them into your stories. They have a link in the story so that people can watch the broadcast. Tell about it on Twitter. If you learned something today, which I know you had to, because there was too much life-saving, life-improving information for you to not learn anything, but whatever you learned, and even if you knew all of it, somebody else needs it. Tweet about it. Tag the show. Tag me. Hashtag make it make sense. At Monique Pressley. Okay? I'm stunned. I'm floored myself. I got to go back to the drawing board. I got work to do. This is the work, but I'm going to do some more work. So thank you to Dr. Hebert. Thank you to all of you who were here to join. This is must need, must know information. Praise God. I will see you guys tomorrow. Another great show. We are talking about another part of this same health crisis. We need people in office who care about us. We need people like Vice President Harris, who are going to put the momnibus on the floor and try to get Black maternal health care to be a priority. We need people in Congress, in the House of Representatives, and in the Senate who represent us, who not just look like us, but care about us. We need candidates of conscience. And there is an organization called The Collective. They're a political action committee that specialize in putting good Black people in office. And the founders, the co-founders, Stephanie Brown James and Quentin James of The Collective PAC, will be here with us tomorrow. Don't miss that interview. We're going to get some more information and some more marching orders, because guys, this is our life and this is what we're leaving for our children, and it matters. So let's lean in and put some elbow grease on it and get to work. Thank you so much. I appreciate you. See you tomorrow.